Every year, thousands of people go to sleep and never wake up again. No warning, no pain, no obvious illness, just sudden death in the middle of the night. So what really happens inside the body while a person is sleeping? And why does it happen to people who sometimes look completely healthy? To understand this, we first need to know what the body is doing while we sleep. When you fall asleep, your heart rate slows down, your breathing becomes deeper, and your brain enters different sleep stages. For most people, this is completely safe. But for some people, sleep can trigger hidden medical conditions. One of the biggest causes is something called sudden cardiac arrest. This is not the same as a heart attack. A heart attack happens when blood flow to the heart is blocked. But sudden cardiac arrest happens when the heart suddenly stops beating because of an electrical problem. And when this happens during sleep, the person may never wake up. Sometimes, the cause is an undiagnosed heart condition like hypertrophic cardiomyopathy. In this condition, the heart muscle becomes thicker than normal. This makes it harder for the heart to pump blood, and it can also cause dangerous heart rhythm problems during sleep. This is one reason why even young and healthy-looking people can suddenly die in their sleep. Another hidden cause is something called Brugada syndrome. This condition is very dangerous because many people don't even know they have it. The heart looks normal, but the electrical signals inside the heart suddenly stop working correctly, especially during sleep. In some Asian countries, this condition is one of the most common causes of sudden death during sleep. Another major cause is sleep apnea. Sleep apnea happens when a person stops breathing repeatedly while sleeping. Sometimes the brain wakes the body up just in time. But in severe cases, oxygen levels drop too low, and the heart cannot survive the lack of oxygen. Many people who die in their sleep were never diagnosed with sleep apnea. There is also something called arrhythmia. This means the heart suddenly beats too fast, too slow, or in an abnormal rhythm. During sleep, the body is more relaxed, and the brain is less alert. If a dangerous arrhythmia happens, the body may not react fast enough to save itself. And that's when sudden death can happen silently. Some people think this only happens to older people. But that's not true. Young adults, athletes, and even teenagers have died suddenly in their sleep. In many cases, the real cause is only discovered during a medical examination after death. This is why sudden death during sleep can feel very mysterious, but medically, there is always a reason. So how can someone reduce the risk of dying suddenly in their sleep? Doctors recommend regular heart checkups, especially if there is a family history of sudden death. Treating sleep apnea early can also save lives. And most importantly, never ignore symptoms like chest pain, fainting, or sudden dizziness. Because sometimes, the body gives warnings before something serious happens. Sudden death in sleep is terrifying, but understanding it can help save lives. Your heart works every second, even while you sleep. And taking care of it today may protect you tomorrow. Because sometimes, the difference between life and death is simply awareness.